Back to the SA Morning. Cancer is one of the largest global public health threats. In Africa alone, cancer death rates are higher than those of AIDS, tuberculosis and malaria combined. But despite this, the disease is still quite misunderstood and not an easy topic to discuss. However, it's essential for everyone to be aware of cancer and how screening can actually help prevent it from being deadly. January is also Cervical Cancer Awareness Month. So Visva Pillay, kind enough to join us to talk about this. Team lead at medical diagnostic consultancy BD, speaking to us right now about cervical cancer. Visva, thank you so much for your time and good morning to you. Let's talk firstly, I think, about the importance of observing Cervical Cancer Awareness Month this month.
Good morning to Melo and to all the listeners. Thank you for the opportunity to be speaking about this really important topic. I think the importance it's around, it provides us a perfect opportunity to raise awareness and also education around this topic of cervical cancer. And it's particularly important to encourage women. As you mentioned, it's a really impactful disease affecting millions of people worldwide. And we need to encourage women to go for screening and to prevent this cancer, because unlike other cancers, cervical cancer is actually a very preventable and curable cancer if detected early. So we need to utilize these opportunities to actually encourage or educate people around this disease. But more importantly, Tumel, I think while this is an important month, I think the topic of cervical cancer needs to be discussed on a continuous basis because, like I mentioned, it's a cancer that's both preventable and curable if it's detected in the early stages.
Right, and that importance, Visva, is also informed by the fact that it can get severe if not, treated or detected earlier on. I mentioned some of the stats in the continent alone, saying the stats show that cervical cancer numbers are higher than those of AIDS, TB, and malaria combined. But in a more South African context, how are the numbers looking? How severe is cervical cancer right now?
Yeah, I mean, it is a really severe disease, specifically within South Africa. I think if we look at roughly the population, we have about 20 million women or around the ages of between 15 and 44 who are at risk of developing the cervical cancer. And current estimates, if you look at it, roughly about 11,000 cervical women are diagnosed with cervical cancer annually. And from this, approximately 6,000, so roughly 50% of that would die from the disease in South Africa because it's not detected early enough and treated early enough. And important to also note, if we don't put measures in place, I mean, around 2040, this number would increase by about 50%. And when we speak about South Africa or the South African context, it's also important to speak about women living with HIV, who are 6 times more likely to develop cervical cancer when infected with HPV, which is the human papilloma virus causing the disease, than HIV negative women. And so it's a major threat to the health of women.
Yeah. When we look at screening and testing, what do you think informs women not screening at the rate that is more desirable and that would be more effective? Is it a matter of access to, healthcare facilities? Is it, lack of education and information, as you've shared? What do you think could be the biggest contributing factor to this?
I think it's a combination of both. I think it's a combination of education. I think it's access as well to facilities, because I think most women would know the Pap test, right? Pap smear. And generally you should go for a Pap smear, but there's also developments in terms of now HPV DNA testing that screens for these high risk types of HPV. And it's important that it's around the education and encouraging women to go for that testing on a regular basis to be screened.
Visva, any taboos around cervical cancer that you would like to demystify today? I mean, I can imagine perhaps in some cultural settings, some people, and I'm basing it on assumption here, may believe that, I don't need to, go testing. If I go through any pain, it might be witchcraft. It might be more of a spiritual thing that I need to pray away. We're living in different cultural societies that have different belief systems, but the science is there. The facts are there. What myths would you like to demystify around cervical cancer this morning?
I think it's around the stigmatization. I think HPV, obviously, it's a sexually transmitted disease. And I think we need to take lessons from HIV as well. I think for a long time, it was a taboo subject. People didn't want to talk about it because of stigma and that. And the strides we've made in terms of people now living healthy lives because of the education, because they now were able to talk about it. I think we need to take a similar approach in terms of HPV in that, yes, it is a sexually transmitted disease, but it's not only a woman disease. I mean, men can also get HPV, although not as severe, and it causes other complications. But also HPV, it's important to note that in most cases, HPV would go away on its own within 2 years. And so if we know about these type of things, it's not a topic to avoid or be scared of talking about. And it's also, we must get rid of this hesitation to actually talk about it. And it must be knowledge and awareness is the way we're going to break down those barriers, that it becomes everyday conversation, because it is something, and it's crucial to have that awareness and education, because it's shown early detection saves lives, and that's what we want to ultimately reach.
Yeah, and just in my last question to you, when we look at the cost of treatment, I think there are also conversations around how expensive it is to treat cancer. And I'm assuming here also at very, different stages, very severe stages where specialists are concerned. And that could be a fear factor for some people to say, can I even afford to once I'm found out that I have been diagnosed with cancer? Right now, with the cost of living in South Africa, what are the estimates around treating cervical cancer?
So, Tumela, I don't have the exact costs of treatment of cancer, but again, it goes back to this is a preventable disease.
Right.
It's around, if you get it early, it is something that can be curable, right? I think there's different, also like you mentioned, there's different stages of the disease. And so the earlier treatment, the less, I guess, costly it would be in terms of the surgery required, because I mean, when we talk about treatment, it can range from anything based on the type and the stage of the cancer in terms of where you detected it.
Right.
Anything from a surgery like what they call a loop excision, which is a very, I guess, less cost-effective approach than if you have to go where it's a more advanced and severe, where you go into chemo and radiation therapy.
All right. Well, I appreciate you, of course, speaking to us about this and raising your voice around Cervical Cancer Awareness Month this morning, encouraging the rest of us to continue having this conversation, not only for Jan, but for the rest of the year, for more generations to come. Visva Pillay, thank you so much for joining us. Team lead at Medical Diagnostic Consultancy from BD joining us this morning.